Hi, I'm Tunde, a pharmacist working in London, and in this video we're going to dive deeper into the different weight loss jabs available and see if they're really as good as advertised. So the weight loss injections are called GLP-1 mimetics. So GLP-1 stands for glucagon-like peptide 1. When they bind onto the receptor, it triggers like a cascade of events which are beneficial. Let's go through the key benefits of these medications. They are 1. Enhancing insulin secretion. These medications enhance insulin release in a glucose-dependent manner, which is why they can be used for diabetes. If someone's blood sugar is high, it will increase the amount of insulin released. However, lesser so if someone has a low blood sugar. Number 2, they inhibit glucagon secretion. Glucagon is a hormone that's released to increase your blood glucose. Inhibiting this will help keep your blood glucose under control. Again, why this medication is used for people with type 2 diabetes. The main benefits from weight loss come by these medications slowing the gastric emptying. So they slow how fast food kind of goes through the stomach. This gives a person on these medications a feeling of fullness for longer. This naturally leads to a reduction in the amount of food someone wants to eat, leading to lower calories consumed in a day. Finally, it also influences different regions in the brain, which helps control appetite. It helps reduce the amount of hunger signals people are getting, allowing them to stick to a reduced calorie diet. There are 3 main GLP-1 drugs with a UK license to be used for weight loss. These include semaglutide, with the brand name being Wegovy, tirzepatide, brand name being Mounjaro, or liraglutide, with a brand name of Saxenda or Nevolat. Ozempic isn't licensed for weight loss in the UK, only for type 2 diabetes, but it is the same medication that's in Wegovy. Mounjaro and Wegovy are once a week injections, whereas Saxenda is once a day. All of these medications are started at a low dose, which is built up to a maintenance dose. This is done to reduce the chances of side effects. They're all injected into either the abdomen, the thigh, or the upper arm. And they're all subcutaneous injections, so just under the skin. Common side effects of these medications include nausea, dizziness, vomiting, headaches. So gastrointestinal problems are the most common side effect with this medication. However, they tend to diminish within the first few days or weeks of starting the medication. This is the reason for starting on the low dose and building it up. But it's important to stay hydrated when taking these medications, especially if you're experiencing any of these gastrointestinal side effects. Other serious but less common side effects include pancreatitis, gallstones, or severe allergic reactions. These are relatively new drugs which are still under surveillance, and new side effects and warnings are constantly coming to light. So it's not recommended to keep taking this medication if you're unwell because of the risk of something called euglycemic ketoacidosis. So it's where your body starts using fat as a fuel even when your blood sugars are normal, and the symptoms of this can be really dangerous. So the SURMOUNT-1 trial showed good efficacy for Mounjaro. It included 2,539 patients with a BMI above 30 kilograms per meter squared, or a BMI between 27 and 30 kilograms per meter squared, and also 1 other weight-related condition such as high cholesterol or high blood pressure. So the study found that Mounjaro led to a significant reduction in weight loss compared to placebo, with an average of 16% weight loss with the 5 mg, 21% weight loss for the 10 mg, and 22% average weight loss for the 15 mg. It found that 63% of patients lost over 20% of their body weight when on the 15 milligrams a week maintenance dose. So what about Wegovy? Trials use the same inclusion criteria as Mounjaro. So the average weight loss on the Wegovy was 15% on the full maintenance dose, compared to only 2.6% in the control group who only received placebo. 30% of the patients in their trials saw a reduction in their body weight of over 20%. So finally, Saxenda. So the trials seem to show that the efficacy of liraglutide seems to be linked to whether someone's an early responder or not. This was defined as a decrease of body weight of at least 5% in the first 12 weeks. 51% of these participants achieved a weight loss of over 10% after 1 year. However, for participants that didn't lose over 5% in the body weight in the first 12 weeks, 93% of these participants did not lose over 10% of their body weight in the first year. So I hope it's quite clear that these jabs are quite effective, and they can really give someone their life back, helping them lose weight and increasing their overall health. It's just important to remember that when used for weight loss, they have to be used in combination with a reduced calorie diet and lifestyle changes. For example, increasing the amount of physical activity you can do. Many people using them at the moment are using them privately because on the NHS in most regions, they're only available to specialists, bariatric teams. They are new drugs in the grand scheme of medications, and their side effects are still being monitored. If you are taking one of these medications and you experience a side effect, please report it via the yellow card system. If you just Google yellow card scheme, you'll just have to fill out what dose you're taking, why you're taking it, and kind of some more information about what side effects you experience. So if you have any questions about anything I've mentioned in this video, feel free to let me know in the comments, and I'll see you next time.